going to talk about what is heart disease, its risks, symptoms, and the conventional treatments. According to the World Health Organization, cardiovascular disease takes the life of 17.9 million people every year, which is 31% of all global deaths, which means there are more than 200 deaths around the world every second due to cardiovascular diseases. In 2017, there were 9,292 deaths from cardiovascular diseases in Singapore, which means 17 people die from cardiovascular disease every day, which accounts for 1 out of every 3 deaths in Singapore. So what is cardiovascular disease? Well, cardiovascular disease can refer to a number of conditions. Heart and blood vessel disease, also called heart disease, includes numerous problems, many of which are related to a process called atherosclerosis. Atherosclerosis is a condition that develops when a substance called plaque builds up in the wall of our arteries. This buildup narrows the arteries, making it harder for blood to flow through. If a blood clot forms, it can block the blood flow. This can cause a heart attack or stroke. When a patient exerts himself, he may experience chest pain and pressure, also known as angina. If plaque ruptures, a blood clot can form within the artery, as shown in figure 3. A heart attack occurs when the blood flow to a part of the heart is blocked by a blood clot. If this clot cuts off the blood flow completely, the part of the heart muscle supplied by the artery begins to die. Most people survive their first heart attack and return to their normal lives, enjoying many more years of productive activity. But experiencing a heart attack does mean that you need to make some dietary changes. When there's a blood clot in the heart, it results in a heart attack. When it occurs in the brain, it results in a stroke. At the feet, it results in gangrene. An aneurysm is an abnormal bulge in the artery anywhere in the body caused by atherosclerosis. It occurs on the blood vessel, and common areas includes the heart, brain, lower limbs, intestine, and spleen. As you can see, there's an abnormal bulge in the artery over here due to blood clot. An ischemic stroke, which is the most common type of stroke, occurs when the blood vessel that feeds the brain gets blocked, usually from a blood clot. When the blood vessel to a part of the brain is cut off, some brain cells will begin to die. This can result in a loss of function controlled by that part of the brain, such as walking or talking. Some effects of stroke are permanent. If too many brain cells die after being starved of oxygen, these cells can never be replaced. Atherosclerosis, the hardening of the arteries, begin in childhood. At the age of 10, the arteries of nearly all children raised on a standard American diet, which includes eggs, dairy, and meat, already have fatty streaks, which is the first stage of the disease. Then the plaques begin to form in our 20s, gets worse in our 30s, and then start killing us off. So if there is anyone watching this older than the age of 10, then the choice isn't whether or not to eat healthy to prevent heart disease. It is whether or not you want to reverse the heart disease you already likely have. As you can see in the diagram, at the age of 0, there's initial lesion. Age 5 to 26, fatty streaks. Age 20 to 30, fibrous plaque. Then 40 to 50, the calcification of the arteries, which is the hardening of the artery, as you've seen in the photo. At the age of 50, it results in a rupture or blood clot, which will cause a heart attack. Conventional treatment for cardiovascular disease includes prescription drugs like cholesterol-lowering statin drugs, which is the most popular statin drugs globally, is Lipitor. Statin drugs may be able to reduce absolute risk of heart attacks by 31% over 6 years, while a whole food plant-based diet has an absolute risk reduction of 60% in less than 4 years. Like many drugs, the more it claims to cure, the more side effects it has. Statin drugs have adverse side effects like liver damage, muscle damage, which increases fall risk, memory loss, confusion, diabetes, breast cancer, just to name a few. There are many surgeries for people suffering from cardiovascular diseases. The first one is coronary artery bypass grafting, which costs $324,000. The surgery is used to bypass the blocked arteries with a vein from the leg or in the chest. The survival rate of the surgery is 95 to 98%, and the reoccurrence rate of the disease after the surgery is 40% after 1 year and 50% after 10 years. Complications of the surgery includes bleeding during and after the surgery, blood clots causing heart attack, stroke or lung problems, infection, pneumonia, breathing problems, pancreatitis, kidney failure, heart rejection, abnormal heart rhythm, and death. Now I'm going to show a video on how coronary artery bypass grafting is done.
A coronary artery bypass graft, or CABG, is performed to improve circulation to the heart muscle in people with severe coronary artery disease. In this procedure, a healthy artery or vein from another part of the body is connected or grafted to the blocked coronary artery. The grafted artery or vein bypasses the blocked portion of the coronary artery, carrying oxygen-rich blood to the heart muscle. One or more coronary arteries may be bypassed during a single operation. Your surgeon begins by making an incision in the skin over your breastbone or sternum. He or she will then cut the sternum and move your rib cage in order to get to your heart. Throughout the procedure, your circulatory system will be connected to a cardiopulmonary bypass pump or heart-lung machine. This machine temporarily performs the functions of your heart and lungs during the surgery, allowing your heart to be stopped while the surgeon sews the grafts into place. One of two blood vessels is typically used for the grafts: the internal thoracic artery in the chest or the saphenous vein in the leg. For the internal thoracic artery graft, your surgeon will leave the upper end attached to the subclavian artery and divert the lower end from your chest wall to your coronary artery just beyond the blockage. Your surgeon will then sew the graft into place. For the saphenous vein graft, your surgeon will suture one end to the aorta and the other end to the narrowed artery just beyond the blockage. With the graft securely in place, your surgeon will use electrical signals to restore the heartbeat and attach a temporary pacemaker to the heart. Once your heart is again beating normally, the heart-lung machine will be disconnected. Your surgeon will wire the breastbone back together and suture the skin incision closed. A temporary drainage tube will be placed through the skin beneath the incision.
Next, we have angioplasty with stent implant. It's the widening of the artery with a balloon and implanting a stent to keep it open. The survival rate of the surgery is 90%, and the reoccurrence rate of the disease after the surgery is 30 to 40%. The surgery costs about $61,800, and the complications include bleeding during and after the surgery, blood clots or bruising at incision, scar tissue or blood clots at stent, irregular heartbeat, and death. Now I'm going to play the video to explain more about angioplasty.
Coronary angioplasty opens narrowed coronary arteries. A small, hollow tube called a catheter is inserted into an artery in the groin or arm and threaded to the affected artery. A thin, flexible metal wire is then advanced through this tube and past the site of blockage in the artery. A second, smaller catheter is then inserted over the wire and threaded to the same artery. When it reaches the narrowed area, a small balloon on its tip is inflated to reopen the artery and flatten the blockage into the artery wall, while at the same time stretching the artery open to increase blood flow to the heart. Both catheters and the wire are then withdrawn. About 70 to 90% of coronary angioplasty includes placement of a stent, a wire mesh tube that holds open weakened arteries. The stent may prevent re-narrowing after an artery is widened, and it stays in place permanently as the blood vessel lining heals over it.
Lastly, we have heart transplant, which costs about $800,000 to $1.4 million. It is the replacement of an end-stage failure or weak or damaged heart with a donor's heart. The risk is unknown, and the reoccurrence rate of the disease after surgery is 85% after 1 year, 75% after 3 years, and 60% after 10 years. Complications include bleeding during and after the surgery, blood clot caused after the heart attack, causing a heart attack, stroke or lung problems, infection, pneumonia, breathing problems, pancreatitis, kidney failure, heart rejection, abnormal heart rhythms, and death. We have come to the end of the video, and the next video coming up soon in this series of cardiovascular disease is the cause of heart disease and how to reverse it. Thank you for watching, and see you soon.